This is KTN News.
And welcome back. This is Morning Express. We're getting on to, well, it's now 2 minutes after 8, and the discussion that we're going to be having is in relation to what we call the new normal. Now, the new normal, we do know currently, is that alcohol is not being sold in bars, pubs, and public places. And that, of course, is to try and bring down what we're calling slowing down the curve by ensuring that people are not mingling in that area. But what that has brought about is a result in people looking for a new way of, or new cultures, shall we call them. And the new culture now is people to bring alcohol home or order it at home and drink from home in groups, and that, of course, has raised concerns. So this morning, we're going to be talking to the CEO for the National Authority for the Campaign Against Alcohol and Drug Abuse, otherwise known as NACADA, and that's Mr. Victor Okioma. Thank you for joining us, Mr. Okioma, and thank you for coming on to Morning Express this morning. Just like I've mentioned, we do have a new normal where we don't have alcohol being sold in bars, in pubs, in public places for obvious reasons. And NACADA has raised the flag that that is a cause for concern because people are now drinking from home. What is your concern?
Thank you, Gitonga, for the opportunity to speak to Kenyans. Our concern as an authority is that the new normal, which actually means that people are looking for other ways of accessing their drink outside the bars because they are banned, is that they are now starting to drink from home in the presence of the children who are at home because the schools are closed.
And why
now,
is that?
I think that to me, that was is a matter of concern. Because a home environment should not be a place for drinking. The danger for drinking in the presence of children is that you are kind of trying to give a new value to the culture of drinking. And there's also a possibility that the children will also try what dad or mom is doing.
What they see their parents doing.
The parents doing. And you see, initiation of young people into drinking has become an issue that is of great concern to us as an authority. We have done surveys that they clearly indicate that as young as 11-year-old, they have been initiated into drinking. This is a great concern, and the health experts will tell you that a young mind like that one getting engaged in drinking is a very serious problem.
It's a serious problem. And now that you've talked about surveys, allow me to just bring to the surface the survey carried out by NACADA on the prevalence of drug abuse in secondary schools, and home was, looked at as a risk factor. In this survey, and maybe that's where you're coming from, why was the home becoming a risk factor in terms of the prevalence of drug abuse and alcohol abuse in children in schools?
Actually, the survey that you're referring to informs our concern about the new normal of drinking from home. The survey clearly indicated that young people in schools who have been tried alcohol or any other drug of abuse, when you ask them how they tried it, they say, I got it from the fridge, I got it from the shelf at home, or my father gave me, my mother, that kind of exposure. That is where the concern comes from. So majority of those children who have been initiated into drinking, they started at home. And that's why we, as an authority, think a home has become a risk factor, because it's a point where many of the children who start drinking early, they are initiated at home.
All right.
That is our great concern.
Okay, then what do you propose as the way forward? Because there are those who may say, for mine, it's just, leisure drinking, and I have my home in order. I have told my children that you cannot drink until a certain age for obvious reasons. What advice would you give, and how do we navigate that?
Our advice is that the home should be a place that should be alcohol-free. Our advice is that as parents, we should be the role model of bringing up children who are free from alcohol until they are able to make their own choice in life. And our position as an authority is that the parents who have exposed the young children into drinking, they end up with the problem of alcohol and drug abuse in the families. And it really is a choice that parents have to make. The surveys are very clear that many of the children who have been initiated, many of the young people who have been initiated into early drinking, they started at home. And in any case now, Gitonga, you know, the children are learning. The online learning is going on in many homes. How does it happen? And the children, the parents are drinking and the children are on online studies. How does it make? In fact, the problem has also even been complicated by drinking bouts. Families, friends call each other to some home and they are drinking there. It becomes like some bar in the home where people are making noise and merrymaking in the presence of the children who are learning. So that is our area of concern.
That's your area of concern. And for clarity, Mr. Okioma, one might then think, is Nakada saying that stop drinking at home, let's open up the bars?
Well, we are not saying that. The bars are closed because the guidelines to control the spread, says that we should not open the bars, and we are not encouraging that bars are open. In fact, as an authority, we are happy with the closing of bars and the controlling of the hours of drinking. By 9, people are supposed to be in the houses. What we are saying is that look for any other alternative if you want to enjoy your drink, but please keep the home an alcohol-free environment to allow normal growth of the young people who are in our homes.
All right.
That is our simple message.
Okay, and maybe just to be clear, one might argue that not having alcohol at home is, yes, an indication that, or it would be a good measure to take, but does not entirely solve the problem. Because I'll bring to your attention now, we have a number of, or rather if you drive around, you'll now see what people are converting to alcohol drinking places is just literally on the roadside. You'll see cars parked with loud music. Go to Ngong Hills, you'll find young people who've parked their cars, they're still drinking. So really, removing alcohol from home may even be making it riskier because now they're drinking while they're driving.
Actually, you correctly put it. It's our observation that now the roadside, like you drive through the bypasses and along the many roads in town here, you find groups of people in their cars enjoying their drink. We do not have a problem with that if it can keep the home safe for the children. As we don't have a problem with that. But I think also as a nation, we should not make drinking like something that is a matter of life and death. But if you really have to drink, look for other alternative ways of drinking, but please keep the home safe for the children. That's our simple message from Nakada.
All right, so do you have suggestions of alternatives? Because then there are those who might feel like Nakada is trying to say, okay, fine, stop drinking all the same. But there are those who just enjoy their drink and they feel that would be an infringement on their liberty and rights.
By the way, we would not be having any problem if the alternative does not exist and you have to go to the roadside and drink. And really, Nakada is not the one to blame, because these are guidelines that have been issued to make sure that we contain this pandemic. So, blaming Nakada for saying you should not drink at home, I think will be an excuse for just encouraging your drinking habit. And we are saying, drink it elsewhere, anywhere else. The bars are closed. Look for other alternative ways of enjoying your drink. But we are saying the home is a risk factor, and it has actually been proved that it is causing a lot of early drinking among the young people. And it is a problem that we really need to confront as a nation.
All right, Mr. Okioma, maybe just for you to highlight the importance, because when we talk about the home, we're not just talking about a general thing. Could you highlight for us the importance of the parents and guardians for these children, particularly minors, because we are told by psychologists that children learn more from what they see than what we tell them. So the importance of the guardian and the parent, even as we talk about the home, to just define their responsibility.
By the way, the authority has been carrying out a positive parenting program on our radio, both national and FM stations across the country. And our message has been very simple. The parent is the role model for the child, has a very powerful influence on the young person. The child looks up to us to be able to grow and become, a good citizen. So, as very influential people among, for our children, we need to positively influence them and make sure they grow into citizens who know that the drinking is only allowed for a certain age, and that there are certain dangers of drinking, so that they are able to make a choice. So what we do, the children will obviously see that it is something good. So if we drink, then they will say there's nothing wrong in drinking, and they will start drinking very early. So what our simple message is that positive parenting involves us setting the standards and influencing our children to grow knowing that drinking is something that is meant for the adults, and it will come by the way, and there are also dangers to it, so that you are able to make a choice. But we should not allow it to happen that early in their life.
All right. Other than some might feel that the authority, NACADA, is acting as the police and just giving us statistics and figures, what else is the authority doing to ensure that we become a more responsible and quote-unquote sober society?
By the way, let me make one thing clear, that we are not becoming the police. This is a moral issue. We are not even, drinking at home. I don't even know whether you can be arrested for drinking in the presence of your children, because there is no offense you will have committed. But what we are saying is that it has its danger. So this is just an awareness campaign that exposing the young people to early initiation to drinking has its own dangers. And this is not a legal issue. This is a moral issue. It's really up to you. Even now, we are not going around to say who is drinking in the presence of the children, and we are not going to do that. What we do is we give them a message. You have asked what else do we do?
Right.
We do surveys like the ones you are referring to, and we share with the public about the dangers, the matching trends in drinking, very new drugs that have come into the market which are being abused, and we expose all these facts from our surveys to the public so that they are able to support the campaign and they are able to be aware about the dangers in drug abuse in the country. We do many other campaigns like the positive parenting. We go to schools, we talk to children in schools, about the dangers of drug abuse and the kind of substances that are available so that they are aware and avoid them. So beyond talking about drinking at home, we do many, many other things that as an authority, gives our campaign a profile among the public so that they are aware what the dangers are in the country.
All right, so you've mentioned and you've rightly put it that this is a moral issue and it is one that is left to one's conscience. Is the authority engaging the necessary, institutions, for instance, churches and mosques and religious organizations, to ensure that this message is put across? Because then, to have the service out there is good, it's a good start, but I think we need to do a bit more to ensure that people are enlightened and are aware of the dangers that they might be putting the minors through just by their irresponsible behavior.
Yeah, we do a lot of campaigns among those institutions and churches and the community level. We carry out very many community dialogues. We talk to groups. We engage the youth in their own groups. We have actually a program that where we engage the churches, and the churches have been very supportive in this campaign. We have a program called the Workplace Program, where we engage with institutions, and we even share with them some of the surveys we have carried out. The Workplace Program is meant to deal with the drug abuse in the workplace because of its implications on productivity. In the churches, we have had a lot of interaction with the churches, where they are able to actually talk to parents. They sometimes have allowed us to run campaigns within the churches, and we engage a lot of those communities. In schools, I've said we have a school-based program where we sometimes train the teachers whom we use as our contacts. Sometimes we also go and engage with the students in schools and the teachers. Our program on awareness and advocacy is elaborate, and we have a lot of cluster of population that we engage.
All right. And surveys, information and what would I call it, research is critical and important for us to know why we are where we are. Kenya is viewed, or maybe from your end you'll tell us, is in East Africa, is basically top in terms of how much we drink. What is the reason for this? What do you think is the reason for us Kenyans to be so indulgent when it comes to alcohol?
Oh, there are many factors that are responsible. Sometimes people drink to fit in a certain class. Sometimes others drink because they want to solve their own stress in their minds. Others drink because, people of my class drink. There are many, many reasons. Peer influence is a big contribution to drinking. And there are many, many reasons why people drink. But I can tell you that as a country, alcohol, particularly alcohol abuse, is a challenge. It's a serious problem that we need to address. In the past, we have talked about Kenya being a transit country. Now we can tell you that increasingly we have a consumer. We become a consumer country. We are a destination of hard drugs, which originally will pass through here to Europe and America. We have a problem. And if you look at our surveys, you will clearly see the growing trend in alcohol and drug abuse in the country. So we have, as a nation, we have a drinking problem that we must address.
And the reason I ask that is because...
And you can even see it.
The reason I ask that is because the National Authority for the Campaign Against Alcohol and Drug Abuse was put in place to ensure that we reduce those numbers. Do you think we have reduced them from the time NACADA came into play? Because then the question might be, why do we need NACADA?
Really, it's not about reducing the numbers. It is a question of getting the surveys and sharing the facts with the Kenyans so that they are able to make a choice. Yeah, so our campaign is to create the awareness so that people are able to decide for themselves whether they should drink or not drink.
All right. So what then would be
So
the
it's not
objective and the
about
mandate
numbers.
of what then would be the objective and mandate of NACADA? Because we can get figures and statistics from other bodies. We don't need NACADA to give us figures. We already have those.
Who else is giving the figures on the alcohol and drug abuse in the country? I don't know. Because we are dedicated to doing the surveys and sharing this information with the public, I'm not aware whether there is any other body of government that is doing that kind of work.
All right, so what you're saying is that NACADA is purely there to give us facts and figures as opposed to try and arrest and bring down the numbers.
Well, let me also say this, that besides giving you the figures, we work with the various agencies to check on compliance issues. If we have, for example, said the bus should close at 11 under the normal circumstances and that they should not be open, we also work with the security agencies to ensure that this is compliance, because the more hours you open the bars, the availability is increased. So you somehow are able to control by limiting the hours of drinking. We work very closely with the other bodies like the Kenya Bureau of Standards to inspect the quality of alcohol in the market, so that we have only certified alcohol in the market. I can tell you that there are so many counterfeit alcohol in the market. All these are things we do with other agencies, besides creating their campaign, making Kenyans aware about the dangers of drugs. We also do a lot of enforcement operations jointly with the security agencies and with other organizations. So there's a lot more that we do. There's a lot more that we do other than telling you the dangers of drugs and substance abuse.
All right, and as we get to the tail end of this interview, what message do you have for Kenya, particularly given that we are the main focus now is looking at drinking from home? What message do you have to Kenyans?
Our message to Kenyans is very simple. Let us follow the guidelines issued by government on how to contain the pandemic that is with us. But more importantly, let us not use homes as bars because the bars are closed. That is our simple message. The home is an environment for your young children who are on online studies. The children do not need to be influenced negatively to start drinking early, because it has a problem with the growth of those children, and the research will tell you that young minds engaging in drinking normally have a health problem as they grow. This is our simple message.
All right, and your parting shot, as you also let us know, for anybody who might be suffering from alcohol abuse or alcoholism, does NACADA offer any help for them, and where would you advise that they go?
That is a very good question. As an authority, we are mandated to inspect and license rehabilitation facilities. In this country, we have a big problem of many rehabs which do not meet the standards that are required. If you went to our website and checked the accredited facilities in our website, you should be able to access those accredited facilities which can be of help to you and to those of us who have a drug-related problem. About 90% of the facilities that are available are privately managed, and they are commercial, and therefore become a bit a problem in accessibility because of the cost. Currently, we are working with a number of counties, county governments, to create, to develop publicly owned facilities which will be cheaper and are more accessible to those who are suffering and need help.
Right.
And I'm appealing to county governments. To build more of these facilities to make them more affordable to many Kenyans who need this service.
All right. Thank you very much, Mr. Victor Okioma, who is the CEO for the National Authority for the Campaign Against Alcohol and Drug Abuse, NACADA. Thank you very much for joining us this morning. And, that brings us to 27 minutes after 8 o'clock, and time for us to take a short break right here on Morning Express, and we'll come back with international news. But allow me to just read a few comments on the question that we have asked this morning, and we had asked you whether you feel Ken Lusaka, the Senate Speaker, should take responsibility for the stalemate that we have had in the Senate. We have Team Yarera, who says he should resign and go to Pungoma to sell cold and wheelbarrows, according to him. We have Mobiwa Agikoyo, who says, no, blame does not help. Should Lusaka do an elachi should be the question. In other words, should he literally just resign? We have Ndungu Wakamau, who says 100% yes. Being the Speaker of the House, he should act neutral, but he has failed to do so. He should borrow a leaf from Kenneth Marende, who was the best speaker